maybe they and they have some back pain. How do they know when it's time to leave their house, the comfort and safety of their home, and go to an ER or go to a doctor's office?
Important question, Penelope. I would say look for three things to know that it's urgent to seek care. Number one, if you develop groin numbness, if you feel like you're becoming incontinent, the inner thighs become numb and the groin becomes numb, that's a really important one. And the risks of the virus, I believe, are outweighed by the possibility of permanent neurological damage. Number two, if you're having significant fevers in conjunction with back pain, not only can the fevers be a sign of coronavirus, you could also be dealing with an issue of an infection in the spine, such as discitis. Now that's rare, but that can become an emergency if it evolves to compress the nerves. So for that second one, fever in conjunction with back pain, I would see a practitioner. That doesn't mean running to the hospital. Just like with all of the questions where you're not really sure, get help online. There are many providers now that are willing to answer questions online, and they will help you differentiate whether this is a real emergency or not. The last one, I would say, is in the gray area, which is sudden, acute onset losing weight without you trying to lose weight. So you find yourself, you weigh yourself, you're 5 pounds less, another week you're 10 pounds less. Now, that's a concern for cancer, but in times where immunocompromise is the biggest concern with the infection, it would be really important to speak to an oncologist or your primary care doctor, and to differentiate whether this is something that can wait or something that can be addressed. I guess to sum up, overall, if in doubt, ask the questions. Many of us have moved to the online realm to provide help online, and please don't hesitate.
No, when you say online, are you talking about telehealth also, so they can speak to you on the phone, or they can do FaceTime with you? Do you do those kinds of consultations?
All of the above, absolutely. Telehealth, we use FaceTime, WhatsApp, Skype, whatever is easier for patients. My office staff were kind enough to set us up to be as flexible as possible, and my colleagues, for example, Dr. Mena, who takes care of back pain and neck pain patients as well from an interventional pain standpoint, meaning with injections, with conservative care, he has also moved his practice online. So I would say make an effort and find physicians that are available online and talk to them.
Think about what is that would require not just that you call a physician, but that you go to seek urgent.
So I would say starting from the most severe to the least severe, in a spectrum of things that need urgent care, in a spectrum of things where the risk of staying home is actually more severe, more dangerous, higher risk than exposing yourself to the outdoors and to the potential coronavirus. So these things are, number one, groin numbness. If you start to develop numbness in the extremities, arms or legs, but specifically groin numbness, that's a significant concern. That's consistent with what's called cauda equina, where all of the nerves are compressed, and it's important to seek care. Number two, if you become incontinent, if you start to pee on yourself and you feel like you don't feel it coming, that's a concern, and that needs urgent care from my standpoint. And then pain that's associated with what's called radiculopathy, where neck pain goes down to the arms or back pain goes down to the legs, sometimes that can progress to numbness and weakness. In that case, that becomes an emergency. And from the governor, from our hospital leadership, they were very clear to differentiate neurological emergencies as something that should not wait in a situation where there is a risk of the virus outside.
Okay, so would you recommend that those patients call somebody, call their physician, call their doctor first and then go, or just go?
Absolutely. You know, these are trying times. Don't leave things to chance. Talk to a practitioner or just go to the ER. I think it's always a safe bet to try to seek care. I mean, I'm available 24/7, and a lot of our colleagues are as well. But if in doubt, incontinence, groin numbness, or extremity numbness and weakness, that deserves a visit to see a physician, maybe even going to the ER.
Now, let me ask you couple of other questions. In terms of doing telemedicine and online consults, you're a very hands-on physician and surgeon. So how do you do what you do over the phone, over the computer?
It's tricky, this is the moment where you just have to learn and evolve. But about 15 years ago, I was involved in creating telemedicine with remote locations like Fiji and Samoa. And I remember back then the way that we did it, and I've sort of carried that skill till now. Specifically, I ask patients to do these conferences with me with another person in the room. So if I have to ask a patient to do something that requires another pair of hands, there's a family member to help, perhaps a nurse, or even just your spouse, your loved one, your parent, your kid, somebody to help sort of bring the arm to the right position. And during the physical exam, I would explain exactly how to do it. If it elicits the same pain that I'm looking for, that's a confirmatory test, and I didn't have to be there to actually feel the patient. Now look, absolutely no question, a video conference is not a substitute for a physical exam. It's not a substitute for a face-to-face meeting. But we have to do a really good job now at weighing the risks and benefits. And if going outside has a potentially increased risk of an infection, and if I can accomplish a lot just over the phone, then it's reasonable to make that the first step.
Great answer. And it actually attributes itself, and it applies to many different kinds of consults, which is what we're doing right now. Seen as one of the symptoms, but it can show up with the coronavirus. Tell me why, and when should somebody who maybe hasn't had a lot of back pain in their life, if they suddenly get it associated with a fever, what should they do then?
So the most common cause of back pain is muscle pain, but with a viral illness like with a flu, there is something called a myalgia, where you start to feel your whole body sort of hurt and you feel true muscle pain. That can cause back pain as well. Now, if you have that, then it will be important to differentiate whether that back pain is a sign of something dangerous or not. But I don't feel like I'm capable to empower the patients to sort of take in the whole slew of medical information and make that decision, which is why I would really advise patients that if in doubt, because back pain can be a sign of coronavirus, if in doubt, the first step should be to seek a consultation. And luckily, a lot of physicians now have moved their practices online. Try to seek care to help decide whether it's reasonable to rush to the ER or whether this is something that is safe to sort of wait it out for another week or two until things become, more reasonable.
Okay, and please, that's what we want, a week or two, not another month or two. You have a number of people who, before this, I imagine, were scheduled for surgery because they had intense pain. What are you doing for them? You're not doing surgery right now, I imagine.
Oh, this is a painful subject, Penelope. These patients have been waiting sometimes for months. I have a patient with cancer who needs urgent surgery. So it was really an effort to educate the patients and to come up to a decision that we're going to wait. So most of my patients at this point are just waiting for the word from our governing bodies. I'm in contact, in constant contact with the head of the operating room at the hospital where I prefer to do most of my surgeries. And we are waiting literally day to day to be given permission to bring the patients back on. So everyone's on the waiting list and we're in constant communication. As soon as the light is green, then it'll just be a busy few weeks, but we'll get it done.
Your patients who are in that, they just to make sure that they can hang out for a few weeks.
This is a real painful subject, specifically because there aren't a lot of options. The safest is to try these nerve stabilizing agents like gabapentin or Lyrica, and they do tend to help patients who have nerve pain, meaning pain that goes down the arm or pain that starts in the back and goes down the leg. I'm not a big fan of these medications, but when there isn't much else to offer, I think it's reasonable to try that, and I have given that to some patients with good result. I have also given patients steroids. Now, in that, I have to educate my patients that there's a theoretically increased risk of developing an infection. Now, we've been running a study here out of my office for the past few years on the deleterious effects of steroids when it comes to infections, and we've had zero, but the current state of literature, the current sort of medical understanding is that steroids do lower your immunity. So just today I saw this lovely patient who has severe back pain, sciatica, and I've given her some steroids and she says she's going to stay home. She was wearing a mask and gloves. She has no or very low risk of exposure. And she said that living with this pain is just intolerable. I would rather take the medication. That's a reasonable outcome, and I think that that's a safe bet. Again, as long as the patients are aware that there probably is a theoretical risk. Now, injections are off the table. The American Academy of Interventional Pain Specialists have said not to inject patients. Frankly, I disagree with this decision. I think that's an overreaction. A drop of steroids deep in the body is not going to cause an infection, but as good physicians, they're being safe, right? The first rule is do no harm. So it's reasonable that they've made these guidelines. Bottom line is surgeries, injections are going to have to wait, and we're just holding by with some medications.
Do you recommend any kind of non-steroidal anti-inflammatories, or like Advil or whatever, or Tylenol, any of that stuff, any over-the-counter stuff?
Look, I hate to make a blanket statement about things that seem safe and reasonable, because truthfully, taking Advil has some side effects, some risks. You could have an ulcer, and taking Tylenol for a problem that's not going to get better means spending money, leaving the house, going to the pharmacy, exposing yourself for a medication that's not going to help. I think that trying aspirin, Advil, non-steroidals, Tylenol is reasonable, but continuing to take it without a clear, visible improvement, I think may be a mistake.
But in this case where they can't have the surgery, they can't have the injections.
Right, absolutely. But I do believe that, I do believe though strongly that doing something isn't always better than doing the right thing or waiting to do the right thing. Sometimes doing something in the meantime can actually cause more harm. So that's why I'm afraid to sort of make a blanket statement, just take non-steroidals, take some over-the-counter medications. Every patient's different, and I've seen patients who've developed gastritis from non-steroidals. I've seen patients who continue to suffer taking Tylenol, and they continue to go out and buy Tylenol and take more Tylenol. Eventually, there's an issue with liver. So I would just be cautious on anything, and if it's not making an improvement, then I would not proceed and continue doing it.
And they're trying to figure out how to stay active. Any suggestions for them about how to stay active without hurting their backs?
Wow, tough question. Look, try to get in the pool. If you put on a mask, perhaps it's not wrong to go on a brisk walk. We don't have a total lockdown, and perhaps closer to evening time, like when I go to walk my dog, no one's in the streets. It's reasonable to go for a brisk walk, even a run. I think it's very important to stay active. And I would just advise you that it's unlikely that staying active will hurt you further. It's unlikely that just staying active will take you from having sort of common to you back pain to now it being a back emergency. I think staying active is essential, and in general, for my patients and for patients with back and neck pain, I say use pain to guide you. If it hurts, pull back. But if it doesn't hurt, simply being cautious and paralyzing yourself because you're afraid to cause a problem, I think may be a mistake. Use pain to guide you. I think that's a safe bet.
All right, anything else, doctor? Anything else we need to cover? Because it was great. You gave us lots of good information.
Thank you so much. Patients are concerned, of course. My staff is concerned. My family is concerned. But 99% of what we know comes from the media. Very few of us, even physicians, if you're not working in the ER, you don't really know what's going on. Anxiety is a huge problem. When you don't know what's coming, anxiety in itself can be just terrible to how you feel. It can make your pain worse. It can make you feel worse. Stress right now is really through the roof. My advice is, whenever you hear a number, whenever you hear a statistic, whenever you hear that there's a bunch of new cases, ask for the denominator. Ask for the context. Ask for the big picture. Over 20,000 people have already died, but last year 65,000 people died from the same family of viruses. This year, more than 23,000 people have died from influenza. So even though I respect the decisions of Dr. Fauci, and I think that we're doing the right thing by flattening the curve and staying inside, I think it's also important to keep the panic to the minimum and to really understand the quality of evidence that we're receiving. And what that means in specific detail is when you receive a number, well, there's been 5 more cases. The other day, somebody told me that on Miami Beach, there are 700 infected. My God, it sounds like the zombie apocalypse. How many people were infected last year in Miami Beach? And I guarantee you the number was in the same realm. So please remember, when you hear a number, ask for something to compare it to. Ask for a denominator. Ask for something equivalent that is comparable, so that you can have a real gauge on the magnitude of change, so you could really understand how scary are these scary words that we're reading.